Hi guys, this is Jessica. My flashcard presentation this week is on polycythemia. So here we start with the disease process. So with polycythemia, there are two different types, primary polycythemia and secondary polycythemia. Primary polycythemia, or also known as polycythemia vera, is a condition in which there is an increased production of erythrocytes and other cells in the bone marrow. Primary polycythemia is considered a neoplastic disorder of unknown origin. Secondary polycythemia, or erythrocytosis, is an increase in RBCs that occur in response to prolonged hypoxia and increased erythropoietin secretion. We're going to further go on to the pathophysiology. One study states that polycythemia vera is a myeloproliferative neoplasm characterized by a hypoproliferation of all myeloid cell lineages and driven at least in part by an activating JAK2 mutation. It is also characterized by clonal disorders of hematopoietic stem cells. With polycythemia vera, there is a marked increase in erythrocytes and often in granulocytes and thrombocytes as well, resulting in increased blood volume and viscosity. Blood vessels are distended and blood flow is sluggish, leading to frequent thrombosis and infarctions throughout the body, especially when platelet counts are high. It is mainly characterized by elevated blood cell counts, especially red blood cells, thrombotic as well as hemorrhagic predisposition, a variety of symptoms and cumulative risks of progression to MF and or transformation over time into acute myeloid leukemia. The risk factors are, as stated previously, primary polycythemia has unknown origin that commonly develops between the ages of 40 and 60 years old, although younger individuals can be affected. Meanwhile, secondary polycythemia may be a compensation mechanism intended to increase oxygen transport in the presence of chronic lung disease or heart disease, or from living at high altitudes. Some cases result from erythropoietin secreting tumors such as a renal carcinoma. So the major signs and symptoms and how they are occurring. So the main signs and symptoms for polycythemia would be that the patient appears plethoric and cyanotic with deep bluish-red tone of the skin and mucosa resulting from the engorged blood vessels and sluggish blood flow. Also, hepatomegaly and an enlarged liver and spleen are present. Pruritus is common. Blood pressure increases and the pulse is full and bounding. Obviously, because there is an increase in the cells within your vasculature, that would be why the blood pressure increases and the pulse is full and bounding. Also noted is dyspnea, headaches, or visual disturbances, as well as thrombosis and infarctions may affect the extremities, liver, or kidneys, as well as the brain or the heart. Congestive heart failure frequently develops because of the increased volume and viscosity of blood. And there's also high levels of uric acid resulting from cell destruction, which leads to severe joint pain. Then we move on to the diagnostic testing. So diagnostic testing for polycythemia in regards to, in 2016, the World Health Organization, who revised the diagnostic criteria for polycythemia vera, is to include three major criteria, namely the elevated hemoglobin or hematocrit levels specific for sex, hypercellularity of the trilineage on bone marrow biopsy, as well as presence of the JAK2 V617F or the JAK2 exon 12 mutation, as well as one minor criterion, namely a subnormal serum erythropoietin. As well as we can also collect the following: a CBC with DIF to evaluate H&H levels, as well as a bone marrow biopsy, which would show hypercellular with red marrow replacing some fatty marrow, and obtain an erythropoietin level to gain an understanding of red blood cell production. And then we would also get a JAK2 mutation test, which can be derived from, I believe, blood or bone marrow. And then also the last, we could also get a uric acid level if the patient is complaining of severe pain in their joints. So here are some pictures. This first picture, so let me zoom in. So polycythemia, it says polycythemia vera, a disorder in which the bone marrow overproduction of red blood cells, white blood cells, and platelets. So this picture on the right shows a normal blood smear with red blood cells and white blood cells. But there's a lot of space in between here, which is normal. And then we have polycythemia vera on the left. There is not much space on this side, which you can see is congested by all sorts of cells that we are overproducing. And then down here is another picture that I added. So this is secondary, this pertains to secondary polycythemia, which conditions that cause a compensatory increase in erythropoietin levels. Some causes, like we had stated in the text, living at a high altitude, tumors that secrete erythropoietin, but also can be genetic defects, as well as chronic heart disease, kidney problems such as hydronephrosis or renal stenosis. Anabolic steroids can put you at a high risk for secondary polycythemia, as well as carbon monoxide exposure, lung disease, and sleep apnea. We're going to move on to the next picture, which is this one. So this is another picture I just included because it shows the production of the red blood cells. So we see here on the left a picture of the femur and the pelvis, which further goes into a picture of the bone marrow and how the bone's broken down. And then we have this red arrow that points to the increased blood cell levels. So this red one is increased blood cell levels showing polycythemia. And then this blue arrow is to show healthy blood. So if we look at these two capsules, the bottom one shows healthy blood, which again has a lot of open space within the vasculature. If we go to the top, there is not as much space because it's so congested with all those cells. And I believe that's it for the pictures, and here are my references. I hope you guys like it.